Good morning, everyone. You hear me okay? Wonderful. Well, thank you so much for inviting us here today. We are so proud to be here. My name is Sarah Fideli. I'm the Director of Communications and Marketing for the American Heart Association right here in the Triad. And today we are incredibly honored to be here to present Forsyth County Department of Public Health with 17 CPR adult and child CPR Anytime kits. And these turn bystanders into lifesavers, which is what we're all about here. And these gifts are courtesy of W.R. Vernon Produce as part of our Nation of Lifesavers campaign. And I wanted to take a second, and Ed has afforded me the few moments to share a little bit. We're so excited because this year is actually our 100th birthday of the American Heart Association. So you think about what has happened over 100 years, and we're just incredibly grateful. When we look at the advancements and research that has happened over these 100 years, one of the big ones that we cannot miss the opportunity to share is CPR. So the American Heart Association had the honor of being a part of creating CPR through our research and our funding. Since 1960, CPR has really become a staple in the United States. We still have a lot of work to do. So opportunities like this is what's going to let us complete that work. As of right now, about every year we have around 350,000 sudden cardiac arrests in the United States. I'll repeat that. So 350,000 sudden cardiac arrests in the United States. Unfortunately, about 90% of those are fatal when they are out of the hospital. So we obviously still have a lot of work to do. I want to give one more stat that's really critically important. 70% of out-of-hospital cardiac arrests actually happen in the home. So when you learn how to save a life, most likely you're learning how to save the life of someone you know, someone you care about, and someone you want to survive. Okay? Hands-only CPR is something we also are really talking about today through these kits. And what is hands-only CPR? It's really about doing compressions without worrying about the resuscitation breaths. Okay? So doing compressions, it's really, if you see an adult fall, it is simply calling 911, and it's starting to press hard and fast in the center of the chest to 100 to 120 beats per minute. If you think about staying alive is kind of the go-to, right? So if you have that running in your head, that's what you want to do, staying alive, okay? Now, the reason we talk about hands-only CPR from the American Heart Association is because, again, 70% of people are more comfortable doing just the compressions as opposed to knowing the breaths if they don't know the breaths enough. CPR, again, is always best and amazing. But when it comes to turning bystanders into lifesavers, which is what we're trying to do with the American Heart Association, hands-only CPR is critical. So again, just wanted to thank you so much. We are so proud to donate these CPR Anytime kits to the Forsyth County Department of Health, and we are so honored to do it on behalf of W.R. Vernon Produce. And I will pass it on. Thank you so much.
Good morning, everyone. My name is Joshua Swift, the Forsyth County Public Health Director. Forsyth County Health Director. And I'll take just a few remarks. One, thank you, Sarah, and thank the American Heart Association for this partnership. I want to thank Vernon Produce for this generous donation. And I want to thank the Forsyth County Emergency Medical Services for your partnership. And just a brief bit about how we're going to use these kits. You know, our public health team is out in the community every day. We're in individuals' homes doing care management, and we're going to take these kits and use them to help individuals learn about CPR and be trained on CPR. This could be one-on-one, this could be groups, this could be at a community event where we're doing a health fair and we have a booth. So we're really excited about that. And just like Sarah said, you know, the more people that know CPR, the more lives that will be saved. And you know, public health, our goal is to promote health and improve lives, and there's no better way to do that than by helping more people know how to do CPR. So next I'll ask Dr. Powell from Emergency Medical Services to come up.
I'll adjust this, I'm not quite as tall. So it's nice to meet you. I'm Dr. Stephen Powell. I'm the medical director for Forsyth County Emergency Services. I'm also an emergency physician. I am excited to be here as well. 2024, we decided that we were going to make the patient care goal for Forsyth County Emergency Services to improve cardiac arrest outcomes. This has been an incredible initiative for us, asking us to collaborate with many partners in our community. What we know is that 10% of people survive cardiac arrest across the nation. And for decades, this has not moved at all. This is a crisis, and we have been unsuccessful in improving these outcomes for these patients. In Forsyth County, we are extremely lucky. We're lucky that we have not only better survival than the state and the nation, but also 13% of people here survive with good neurologic recovery, which is what matters. This is a testament to our 911 team, our fire teams, our EMS teams, and really that entire care system, including our community partners with Novant and Atrium. We can't do this without collaboration with every single phase of this care. We're doing really exciting things here in Forsyth County. But to quote our chief, Joey Hunley, we can do better. And I'll tell you right now, as your medical director, we have to do better, okay? We are flying drones through the air, carrying AEDs soon, right? We already have an incredible grant and support from the AHA, who has been here even before today, supporting our Forsyth County community, and that's amazing, so thank you. I'm really excited that we have this contribution again from one of our community partners, Vernon Produce, to give this gift to our community to train more people in how to perform bystander CPR and how to use an AED. Because I'll tell you, when we put people on ECMO and we do these incredible things like eCPR at Wake Forest, those are incredible things. Those are going to help some people. But what's going to help the most people is bystander CPR and AED use. That is what matters the most. You mentioned that 70% of people arrest in their home, and that's absolutely true. And that is what we have to really target as the public, to educate them to be willing to identify somebody who's unconscious, who's not breathing normally. If that's happening, you call 911, you start compressions. It's not going to hurt them, you're going to help them. Find an AED, learn to use an AED. Those are the things that actually matter. So, as you can tell, I'm quite passionate about this. I think I'll end with a story. On Monday actually this week, I went to visit a man who should be dead. He was in the hospital in the cardiovascular intensive care unit, and in fact, I was with my assistant medical director when he died this weekend, and he went into cardiac arrest, and he thankfully survived. And this is a testament to the ER, to the cardiologist who put stents in his heart, to the CVICU team who really continued to allow him to recover. But the real hero was his son, who performed bystander CPR on him while the first responders were en route to his house. So City Fire did an amazing job defibrillating with an AED. Our Forsyth County EMS team did a wonderful job providing further advanced interventions, but it was his son who saved his life. And I think we all need to remember that. So if I can tell you one thing, is to get CPR trained and to learn to use an AED. And I think if you do that, you can save a life. So thank you. In this situation, we have a person who has collapsed, they're unconscious and not breathing normally. We don't check a pulse as a layperson who isn't trained in how to check a pulse. All you have to know is that if somebody's unconscious and they're not breathing normally, that they could and likely are in cardiac arrest. Even gasps, agonal breaths are not actual breathing, and you should start compressions. So the first thing we're going to do is we're going to start high quality chest compressions. So we're going to push on the center of the chest, on the sternum, and we're going to push hard and fast. We're going to go approximately 100 to 120 times a minute, and we're going to go at least 2 inches deep. As we do this, we would be calling 911. We would be talking to our 911 telecommunicators who could guide you through this. Remember, you're not on your own. Our 911 telecommunicators are trained in how to help you here. They're going to ask you to look for an AED if that's available. It may not be available, but if you have one in a public space, or if you have one in your car, or at the produce shop, these are things that could be really helpful to apply before first responders arrive.